All right, mechanism of action of immunosuppressive drugs. Immunosuppressive drugs are pharmaceutical agents used to dampen or suppress the activity of the immune system. They are commonly employed in various medical contexts, including organ transplantation and autoimmune immune diseases, to prevent rejection or alleviate symptoms by reducing immune responses. Understanding how immunosuppressive drugs work is crucial for optimizing their use in clinical settings. Detailed knowledge of their mechanisms allows healthcare professionals to tailor treatment regimens, minimize side effects, and enhance therapeutic outcomes. Moreover, insights into the pathways targeted by these drugs facilitate the development of novel therapeutics with improved efficacy and safety profiles. Thus, unraveling the mechanisms of immunosuppressive drugs is essential for advancing medical care and improving patient outcomes. The immune response pathway is a complex series of interactions involving various cell types, signaling molecules, and regulatory mechanisms. It encompasses both innate and adaptive immunity, which work together to defend the body against pathogens while maintaining tolerance to self-antigens. Key components of this pathway include antigen recognition, activation of immune cells, cytokine signaling, and effector responses. Immunosuppressive drugs selectively target components of the immune response pathway to modulate immune function. These targets may include receptors on immune cells, enzymes involved in signaling cascades, or molecules crucial for cell activation and proliferation. By pinpointing specific molecular targets, immunosuppressive drugs can exert precise control over immune responses, leading to therapeutic effects in conditions characterized by immune dysregulation. Understanding these targets is essential for designing targeted therapies and minimizing off-target effects. Immunosuppressive drugs exert their effects by disrupting key steps within the immune response pathway. This interference can occur through various mechanisms, including binding the specific receptors, blocking enzymatic activity, or altering signaling cascades. By targeting critical components of the pathway, these drugs modulate immune cell function and attenuate inflammatory responses. Depending on the specific drug and its target, various mechanisms of inhibition may come into play. For instance, some drugs may competitively bind to receptors on immune cells, preventing the interaction with activating ligands. Others may inhibit enzymes involved in signal transduction pathways, thereby interrupting downstream cellular responses. Additionally, certain drugs may interfere with cytokine production or function, leading to the downstream effects on immune cell behavior. Understanding these mechanisms is essential for predicting drug efficacy and potential side effects, as well as for developing new therapeutic strategies. Inhibiting key steps within the immune response pathway leads to downregulation of the immune system. This downregulation manifests as reduced immune cell activation, proliferation, and effector function. Consequently, the body's ability to mount effective immune responses against pathogens is compromised, and inflammatory reactions are dampened. Immunosuppressive drugs hinder the function and proliferation of immune cells, including T cells, B cells, and antigen-presenting cells. By modulating the activity of these cells, immunosuppressive drugs mitigate immune-mediated damage in conditions such as autoimmune diseases and transplant rejection. However, this suppression of immune cell function also increases susceptibility to infections and impairs the body's ability to eradicate malignancies. One of the primary outcomes of immunosuppressive therapy is the attenuation of inflammatory responses by dampening the activation of immune cells and the release of pro-inflammatory mediators. These drugs alleviate symptoms associated with inflammation, such as pain, swelling, and tissue damage. This reduction in inflammation is particularly beneficial in autoimmune diseases, where aberrant immune activation contributes to tissue destruction and organ dysfunction. However, it also poses risk, as it may impair the body's ability to fight infections and increase the likelihood of opportunistic pathogens. Numerous clinical studies have provided evidence of the efficacy of immunosuppressive drugs in various medical conditions. These studies evaluate the therapeutic effects of these drugs on patient outcomes, including disease progression, symptom severity, and quality of life. For example, randomized controlled trials have shown the efficacy of immunosuppressive agents such as corticosteroids, calcineurin inhibitors, and biologic agents in the management of autoimmune diseases like rheumatoid arthritis, psoriasis, and inflammatory bowel disease. Mechanistic studies aim to elucidate the precise interactions between immunosuppressive drugs and their molecular targets within the immune response pathway. These studies employ techniques such as biochemical assays, structural biology, and cell-based assays to delineate the mechanisms of drug action. For instance, researchers have elucidated the molecular mechanisms by which calcineurin inhibitors suppress T cell activation by inhibiting calcineurin phosphatase activity, leading to the downstream effects on cytokine production, gene expression. Structural and biochemical analysis provide insights into the molecular architecture and function of immunosuppressive drug targets. Techniques such as X-ray crystallography, nuclear magnetic resonance, or NMR spectroscopy, and mass spectrometry enable researchers to visualize the three-dimensional structures of drug receptor complexes and characterize their binding interactions. These studies enhance our understanding of drug-target interactions and facilitate the rational design of novel immunosuppressive agents with improved efficacy and selectivity. Immunosuppressive drugs play a critical role in managing Immunosuppressive drugs play a critical role in managing various medical conditions by modulating the immune response pathway. Understanding the mechanism of action of these drugs is essential for optimizing their use in clinical practice and developing novel therapeutics. Insights into the mechanisms of immunosuppressive drug enables healthcare professionals to tailor treatment regimens to individual patients, minimize side effects, and optimize therapeutic outcomes. By understanding the pathways targeted by these drugs, clinicians can anticipate potential drug interactions, monitor patients for adverse effects, and adjust treatment strategies accordingly. Ongoing research aims to further elucidate the mechanisms of immunosuppressive drugs and identify novel therapeutic targets for immune-mediated diseases. Advances in drug discovery and development hold promise for the development of more effective and safer immunosuppressive agents with improved selectivity and reduced off-target effects. This comprehensive understanding of immunosuppressive drug mechanisms is essential for advancing medical care and improving patient outcomes in various clinical settings. Thank you.